Brett Gaynor just came in. You missed the song. Too bad, Brett. And who else just joined us that I didn't recognize?
Amber Berkey.
Yeah, Amber Berkey.
Oh, I said hello, but hello again.
Oh, there you are. Oh, so you're multitasking too. I
Yeah, there
see.
we go.
Oh,
Yeah.
am I?
Well,
Yeah, your picture's in one and the other's just a black box with your name.
Oh,
this is all
That's- It's me, Dana Varga. I use her account, so
Oh,
I haven't
okay.
changed the name.
welcome, Dana.
Thank you.
Isn't there a fine there impersonating an officer?
But I don't think she's a Rotarian. Dana, are
He's
you
impersonating somebody.
I am not. We are both from neighborhood healthcare, so
Okay.
we're here to.
So we can't find her, unfortunately.
we'll handle it personally.
Okay, good. So our upcoming calendar next week, we have a board meeting. We do by Zoom. The week following that, Tara Rimmer Lawson will be here, and then Natural Wines from Tammy Wong on the 15th. 16th, we have a Haven House event. Reach out to Kelly, Kelly Cloud. She may have spaces open. Kristen Gaspar on the 22nd. A program on American rugby on the 29th. And rugby is not a type of carpet. Climate change from Blair Lee on the 6th, and then another Haven House on the 7th. Any member moments this week? Okay, I have not heard of any, and so Frank, Gloria, would you want to speak into a member moment at this moment or not?
No, maybe the next one.
Okay,
We
perfect.
have all month.
Okay, perfect. But Frank still gets to talk.
Okay. September birthdays, time to honor our Rotarians that have birthdays in September. On September 2nd is Air Ailing. On September 8th is Sparky Baker. On September 13th is Tom Miller, the real deal. September 14th, Patriot Resnicek. September 15th, Pizza Bill Smith, our own Pizza Bill. September 21st, Julio Gallo. September 21st, Crafty Counselor Stanwood. And Peruvian Princess Ruiz on September 22nd. And September 27th, we have The Voice Sackfield. September 28th, Brix Donaldson. September 30th, Ann Staffieri. And for September, your birthstone is a sapphire, and the September flower is the morning glory. So with that, let's wish our Rotarians a very happy birthday for this month. Happy birthday to you.
Happy birthday
Birthday
to you. Happy birthday, dear Rotarian. Happy birthday to you.
No cake, can't do it yet, but we will in the future.
Yeah, it's all good. It's all good.
I want my cake. I need it too.
Right.
Where's the cake?
What was that, Joe?
Where's the cake?
The cake is on the screen.
Yeah, but it's not here in my house.
Oh, it's in the mail.
Thank you.
All righty. Rotarians in the Wild, I apologize. I got two new this morning that I did not have time to add. So we're just going to go with what's in here. But thank you to those who sent the walking Rotarians and the dog walker from the walking Rotarians this morning. They were really brilliant. I just didn't have time to put them in. So here we have our own Colleen McKinnon doing her first day of third grade teaching as they do their distance learning. Our friend Joe went out and visited Cuscatlan. How was that, Joe? Okay.
You forgot.
Yeah, it was so
Oh,
good.
he's no longer here.
Oh, okay. Well, they seem to like having him there. They actually commented and welcomed him on Facebook as well, so that was good. And here's Aussie looking at what's left of the Grand Canyon after he visited. No? Ossie?
No, it's well, it's part of the Grand Canyon, yeah, but it's in Sedona.
Sedona. Yeah, you see, this just shows you don't invite Ossie to your house because this is all that will be left. And those are our Rotarians in the Wild. Now we have Mr. Sulis to talk to us about an amazing news item. Mr. Sulis. Nick, there you are. You need to unmute, Nick. There you go.
Oh, okie doke. Now I'm unmuted, right? Can you
Yes,
hear me?
correct.
I'll knock on the microphone. Tap, tap, tap. Many of you have already read or heard that the African region has been declared free of wild polio virus. Well, what does this mean? How was it done? What obstacles did we overcome? It means that we are one giant step closer to eradicating polio from the world. We did it through strong commitment, fundraising, team building, coordination, perseverance, volunteers putting their lives in danger, and confidence in the face of adversity. For example, the effort faced in the form of civil war and terrorism from groups such as Boko Haram. You remember that from the story of the young women, the school in Nigeria, northern Nigeria, that were kidnapped. Yeah. Some of whom have been recovered, but others not. That was the country where the last African case was reported. Now, all 47 countries in the African region are wild polio free. But the work in the region remains. The live virus vaccine that's so effective and has been used to eradicate the wild virus now from the 5 of the world's 6 regions can rarely revert to a disease-causing state. The killed Salk polio vaccine will now be used to end this, as it has in other regions. But the wild polio disease now exists only in 2 countries, Afghanistan and Pakistan. The region is called the Eastern Mediterranean region. And yes, I know, insurrection, civil strife, wars, and religious obstruction to immunization are all occurring there. But we, Rotary International, the partnership of the governments around the world, our own Center for Disease Control, the private foundation like the Gates Foundation, have dealt with these impediments and have succeeded in the past, and I trust will do so in the future. So let's give a virtual Rotary rousing round of applause to ourselves and all those who have worked so hard to achieve this terrific milestone. Welcome to us.
Here, let's see, reactions. You can go down to reactions and you can do this too.
How's that?
Yay. Oh, yes. And Sharito says, everyone click the download Centerview. We changed some formatting on Centerview, and I, again, ran out of time yesterday, and that's why you didn't get a hard copy attached to the email. But yes, this article is on Centerview, which is goes into great detail. Unfortunately, Nick did not write it, so it's not quite as interesting as it could have been. But
well, if you want more details, just ask.
Yeah, next time I will, I promise. The San Diego Children's Discovery Museum is having its 20th anniversary gala virtually on the 17th of September. This is one of the directors, always a part of our club. They're a great group. They've been doing amazing stuff. Trudy Bronner is on their board, I believe. And you sign up online, which is also in the Centerview. And if you don't have that, I can send you that information. There's a pre-show and virtual registrations. There's a virtual gala and auction, and it helps support the San Diego Children's Discovery Museum. Also, our own neighborhood healthcare. Would actually anyone from neighborhood healthcare like to talk about the Speakeasy Soiree?
Hi, this is Amber from Neighborhood. I'm the development manager. Tina Pope and I are working very hard on our virtual event, which takes place on September 26th and goes to benefit our unfunded care, which is funding that supports our most vulnerable patients, our uninsured patients throughout the year. I know many of you have been involved over the years and hope to provide some information to you today through our presentation. If you have any questions or any interest, please do reach out to me. I will add my contact information into the chat, but we are honoring Elmer Cameron this year as our first ever servant leader for all of his many, many years of leadership to this area, to Escondido. And so I hope that you will join us in honoring Elmer as he is very deserving. I know, Elmer, you're on the call today, so I'm very happy to recognize you in this manner. I'm going to add in my contact information and the event website, which you can visit and just reach out with any questions. If you would like to purchase tickets, you can do so on that website as well.
I'd really like to meet that Elmer guy someday. He seems like a pretty good guy. Oh, wait a minute. You're just around the corner from me, aren't you, Elmer?
Bravo, Elmer.
And
Congratulations.
for this week's service spotlight, Miss Dara, would you like to talk about the service that you do and why you do it?
Sure, thank you. You guys can hear me okay?
Yes.
Okay, and I apologize if there's any screaming from the background. My kid is playing video games on his lunch, so. Okay, for me, service is actually a way of life. I knew early on that I wanted to make a career out of service. I grew up with parents who always went the extra mile for people. My mom often befriended the homeless individuals who lived in the streets near her work. And my dad was the first one always to assist a neighbor or a relative that needed some help. I saw that my parents lived these values throughout their lives. They were always volunteering throughout their careers and well into their retirement. My dad delivered Meals on Wheels until about a year before he died. And my mother wrote the church newsletter and ran the local library's book club until she went into assisted living. So from about the age of 20, I began to contribute to the community around me. It started as a volunteer at a crisis center doing police, court, and hospital advocacy, and then a part-time job in a homeless shelter until college graduation. I earned a master's degree in social work, solidifying my commitment to the helping profession. As a career, service meant working with kids struggling in drug addiction, families living in poverty, and struggling children in New York State's inner city schools. For me, it meant changing systems that were inequitable. In total, I spent more than 20 years working as a social worker and executive director of nonprofit businesses. I've worked directly with so many different people in so many different situations in their lives. And it was always amazingly rewarding to me to witness people's resilience and grace in the face of extreme hardship. But without a doubt, the most gratifying experiences with service I've had in my life was the work I got to do in Long Beach. There, I had the absolute pleasure of directing an organization that paired middle school kids from impoverished families with local adults who wanted to make a difference. Each adult had a unique relationship with an individual kid for a formal program duration of about 5 years until that kid went off to college. I never met a child or an adult in this program who wasn't better for that relationship. This was the most impactful program I've ever experienced because I got the honor of seeing the very best in adults and in kids. I got to see the life trajectories of these kids change drastically. I never went home from an activity without a true sense that I got to change the world for the better, just a little bit. I never went home without a renewed sense of hope for society. So ultimately, service to me is the finding of meaning in this very crazy and complicated world.
Excellent. Thank you so
Well
much.
said.
And then you joined Rotary and you're going to be an amazing part of our group as well. You are an amazing part of our group, not going to be.
Thank you.
Thank you so much. And let's see here. Oh, San Pasquale Academy and Salvation Army. Keith.
Yes, thank you, President Andrew. I'll keep it fairly brief. I just wanted to give a little report on our drive on Thursday afternoon, and a big thank you to everybody that drove by and donated. you know, the Zoom meetings are good, but it was really nice to see a lot of people in person there, even if there were just distant hugs and no handshakes, but it was just good to see everybody in person again for a change. It was a good reunion, you know? That afternoon, we collected a lot of things. At the end of the day, 4:30, we took everything out to San Pasquale Academy. There were a lot of donations through the afternoon in cash that will be going back out shopping again. Professional shoppers will be out, and we'll be doing another delivery again next week. A couple of the pictures here from it. I don't know whose idea it was to have a donation drive on the afternoon in August. It was like 100 degrees out there, and you saw the one picture of Ron Smith, I think, got a little delirious climbing a pole and pointing to the sign saying, to avoid the excessive heat. But a special thank you to our president, Andrew, and Johnny Watson, and his wife, Donna, Ron Smith, and Charito, that were all out there for the whole afternoon. And we didn't finish till I think about 5:30. Here we are out at San Pasquale Academy delivering everything. And we were pretty spent, I think, by then. It was a bit of an exhausting afternoon, but exceptionally rewarding when you can drop off that much stuff there. You can see on that dolly, there's 100 backpacks there. There were so many things donated. I'd started to name some other individuals that made exceptional donations, but I'd leave somebody out, and I don't think that's why we do it. We just donate for the good feeling that you get and for your moment. So a big thank you to all who donated. Your support of San Pasquale Academy is just amazing.
Beautiful. Thank you. It was a great, great day. Good to see everybody. And just to rush, because I don't want to cut our speakers off, we have a wonderful, fun song today, and it's going to be recorded. So here we go.
It's a beautiful day down at Neighborhood, the best healthy day for a neighbor. Will you be fine? Could you be fine? It's a healthier day here at Neighborhood. The doctors and nurses do so much good. Will you be fine? Won't you be fine? You've always wanted a doctor like Rakesh Patel. At Neighborhood, you know you're going to feel well. So let's make the most here at Rotary. With Dr. Patel, we'll be healthy. You will be fine, all will be fine, because they are our neighbors. Won't you please, would you please listen to our neighbor. Howdy, Escondido Rotary.
Beautiful. I am so impressed with our creativity here with our fun songs. We just got to come up with a singing birthday song. I forget. So here we go. Dr. Patel, it is all you.
Boy, thank you so much. That's a hard act to follow, but I will try my best. Well, thank you all for allowing us some time on your meeting today. And I did want to just begin by just saying thank you to this club, who's actually been a big supporter of our work for quite some time. Both Bill and Smith and Elmer have been board members for quite some time, and I definitely have to recognize Johnny Watson, who shepherded me through my first year as CEO at Neighborhood as the board chair. And so just wanted to say thank you to all of them. And I know there's been other members as well that have been a key part of our organization. All right, can I get to the next slide? So I thought I would just share a little bit of why Neighborhood is important. And really, when it comes down to one of the key metrics that we look at are these two. So the first number there, the 355,000, is the number of visits we did last year. So that zero is part of that zero, the 930, so 355,000. patient visits in 2019. And I'll tell you more about what those visits are in a second. And then that bottom number of 76,000 patients is a number of unique patients, so separate patients that we took care of at our various health centers. And so, you know, a lot of times people wonder, you know, is it just those small clinics down the road? And clearly it's much bigger than that. Out of those 76,000 patients, about 30,000 of those patients were here in Escondido in our locations, just to give you an idea of the local. We are in several regions, but just to give you a part of the Escondido piece. Population of Escondido, I'm not sure, around 150, 160, I think it was 158,000 back in 2018. So roughly 20% if you think of it that way. So let me go on to the next slide. So now I kind of told you a little bit about what we do and how we do that. Let me go into a little bit of the nitty gritties just to give you an idea. So we are what's called a federally qualified health center. And let me give you a little bit of history of what that is and explain how they were set up. So these were formed at the federal level back in the 1960s, 1964, in the President Lyndon Johnson administration. And the health centers were formed as part of the war on poverty, as a way to provide high quality care in communities that otherwise wouldn't have gotten it. And largely they weren't getting it because doctors could not put up a shingle in these locations and survive or keep their doors open, because usually these were patients that didn't have insurance or were getting some very low level of insurance that just the doctors could not take care of those patients. So at the federal level, they came up with health centers as a way to provide care in the community, for the community, and really run by the community. So community health centers was that term. These are entities that are nonprofit. So we're a nonprofit health center here in San Diego, in Escondido. And I went with a couple interesting tidbits as they were formed. First of all, that our board of directors, the majority have to be patients. So they have to be actually users of the health center. So that they understand what the services are. They help dictate what services we do, what we don't do. And so they have a huge influence. I have 13 board members who are my bosses. 8 of those are patients who are actively using the health center. The other key part was that we have to follow what's called the sliding fee scale. And what that means is that basically based on your income, there are minimum requirements of what a minimum fee. However, we're able to waive those fees if needed. But really our mandate is that we are going to see anybody and everyone that walks through our doors. So we really don't turn anyone away. And it's really that, as it says, anyone regardless of situation or circumstance. So whether you have insurance, don't have insurance, whether you're just new to the area, that we're here for you. And so that's really kind of our mandate. Across the United States, there are now over 1,200 health centers. So taking care of over 34 million patients in the United States. And providing really high levels of quality of care. Recently, from the federal government, we got our quality scores back, where neighborhood healthcare was recognized as a national quality leader amongst the various health centers across the country. The populations that we serve largely are low-income populations. So, like as I mentioned, we take care of patients who either don't have insurance or are Medi-Cal, or are frail elderly on Medicare as well. So really those are the main people that we take care of. Many of our patients, English is not their primary language. And so a lot of obviously Spanish speaking populations, Arabic populations, we've got many, many languages that we are delivering services to. The other part that's interesting to talk about is just locally here in San Diego County. One of the things that we don't have really is a county health system in San Diego County. So typically if you go into LA County, there are county clinics. So that's county funded health centers that provide care to these populations. In San Diego, the extent of our county clinics is specialty mental health clinics. But in terms of primary care medical clinics, that work is done by these nonprofit federally qualified health centers. And because of that, we actually call ourselves part of the safety net. And the safety net is really that patients, the ultimate resource is ERs and hospitals, which obviously is very expensive. It's not where you should be going if you've twisted your ankle or you've got a runny nose. But so we are that stopgap before patients end up in those high costs of care, and really are that safety net for our patients. Next slide, please. So in terms of our history at Neighborhood, so that was a history of the health center movement. We've been around over 50 years now. We actually started here in Escondido as a volunteer-free clinic by Dr. Oliver Thomas. And we've continued to expand services, and we'll go through some of the services that we talk about, but this is a large part of the different things that we've done over the years. And we'll go on to the next slide. So one of the things that has happened is that we started as this small free clinic, and over the years, over these 50 years, we've continued to expand, largely because there's just a huge unmet need in these various communities that we serve. So historically, as I mentioned, you know, we take care of almost 2/3 of, well, not almost half of our patients here in Escondido, the 31 out of the 76,000. But we've also expanded into other parts of the county. So back in the early 2000s, we were in East County, El Cajon and Lakeside. Most recently, we've added a location in Poway, and we'll be adding a location in Valley Center in the next several months. And then we've also continued our expansion into Riverside County. So we historically had a large health center in Temecula. We've expanded into Menifee, Hemet, and we'll continue to expand northward. One of the reasons that we believe in expansion is really providing high quality care to these populations. In San Diego County, about 2/3 of the low-income population are now being served by health centers, which is a great thing. In Riverside County, unfortunately, that number is less than a third. It's probably about 30%. And what we know is that when patients come into health centers, as you'll see in the next couple of slides, they get a lot more services than they would normally get in just a regular practice. I did want to highlight just Interfaith there as one of our partners, and where we've added a site in Interfaith. And we'll talk a little bit more about that, but go ahead to the next slide. Really, our vision at Neighborhood is this: it's a community where everyone is healthy and happy. And it's not just about medical care, and we'll talk about all those services, but really at the crux of this is that we believe that healthcare is a right and not a privilege. So the work that we do each and every day is to make sure that we have access for our patients to the high quality of care that all of us deserve and are entitled to. And that's really the work that we do each and every day. I'll go to the next slide. So how do we do that? Let me talk a little bit about the various services that we provide. Historically, in medical services, the patient would come to the practice, and then they would get referred out as they needed other services. Whether that's, for instance, let's just say that you had some back issues, you get referred out to a chiropractor or physical therapy, or if you ended up pregnant, you needed to go see an OB. What we found in our population, given the challenges that our patients have with transportation, resources, getting to these other locations can be really challenging. And so what we've moved to a model of what's called patient-centered medical home, as this picture denotes. So not only do we take care of pregnant moms to elderly, but we really wrap around all of these services to them. And so instead of them having to get referred out, figuring out transportation to these different entities, we really are starting to link with services under our roofs. And so a lot of these services are available in the same location that they're getting their medical care, or right next door or in the region. I did want to spend a little time just talking about Project Dulce. So out of those 76,000 patients, about a third of those patients are either pre-diabetic or they're diabetic. So we take care of about 8,000 patients with diabetes each year. And we know about 16,000 of those patients are on their way to becoming diabetic if something doesn't change in their life. And usually that's weight loss and changing their diet and nutrition. With the Project Dulce program is a program that we've been doing since the 90s as a partnership with Scripps Whittier, which is a diabetes institute with Scripps Health. Through that program, utilizing specialized nurses who are certified diabetic educators, we're able to provide comprehensive care to diabetic patients. Diabetes is a complicated illness. It involves not only just taking medications, but getting your feet checked, your eyes checked, lots of different pieces. And through this comprehensive program, we've been able to really actively manage our diabetes patients to get them the control that they need. And so services that we've added, like podiatry, to make sure that they're getting their feet care, has been really important, as well as immunizations and other pieces. We are starting to work on those pre-diabetics as well. Before COVID, we were running some classes through the diabetes prevention program as a way to help them lose weight and prevent the ills of diabetes. Next slide. So these are some of the services that were on the same slide. I just kind of wanted to put this slide here to kind of show the gamut of services that we provide. And really, it is as early as, you know, pregnant moms to seniors. And what we really pride ourselves is on basically family care. It's not just episodic care. So a couple of questions that people ask me a lot of times is, one is, well, do the patients just come one time to the health center? Is it just for emergencies, and are you kind of like that last resort? And I would say no. We've had patients, when I was practicing in our El Cajon office, I had patients with me that aged with me, and so we aged together, but they were with me for 15 years. We are their primary care doc. Our average patient will come to the clinic about 3.5 times a year. Some of our patients will come once a year for a physical. Other patients who are really sick are coming monthly. Sometimes they'll even come a couple times a week if we're monitoring an infection or things like that. But you know, and then the next question I get is sometimes like, well, where do the docs come from? You know, the docs have choices. They can go work for, you know, Scripps or Sharp and things like that. And I say that the easiest way for me to tell you that is when we pick up the resume of one of our docs. And usually these are docs who worked in Africa, worked in Haiti, worked in Nepal or Ecuador, did mission work. Some of the work that you all described with polio in Africa, some of our docs have been doing work like that as well. And so a lot of our docs are basically wanting to practice medicine that they do abroad, but here in the United States. And that would be my story as well. I was in Haiti in February doing some medical work as well. But really what it is a commitment to, you know, improving the health for our vulnerable populations. And those are our docs, and so committed to the work that we do. Next slide. So not only do we provide medical services, but we also provide dental services. And so the next couple of slides, we'll kind of talk about the gamut. Here in Escondido, our location provides services really to pediatric patients and prenatal patients. We do have other entities that we contract with to provide more comprehensive adult services. We can handle emergencies and provide comprehensive treatment. You know, one of the important things is linking our patients to proper dental care, because if you don't have healthy dentition, it's really hard to have great nutrition. And so that's some of the work that we do as we work with some of our patients. Next slide. Behavioral health services is an area that we've invested a lot of time and resources in. About 10 years ago, we moved into what's an integrated behavioral health model. And this is where in our primary care offices, we've embedded therapists, so psychologists, to be available to provide ongoing therapy or emergent therapy. As an example, I could be seeing a patient with depression who's, you know, they came in for a sprained ankle. We screen them and we find out that they're unfortunately suffering from some significant depression. I can call an audible, or what we call a warm handoff, and have the therapist come in the room right at that same time and briefly have a conversation. I actually step out of the room, and now a trained professional can come into the room and spend some time with that patient and understand how to meet the needs of that patient right now and the future. So it may be as simple as, you know, I'm just going through a little bit of a tough time. Maybe we can schedule a few sessions to talk about those. Or it may be, you know, I used to be on medication. I feel like I need a medication. Can you get me to a psychiatrist? Which we also have on staff as well. So it's been really helpful. As you can imagine, during COVID, we're seeing quite a bit more mental health issues, and having these counselors available readily has been really important to help our patients navigate through some pretty tough times. The third bucket there is the medication-assisted treatment, and that's really helping patients who suffer from alcohol and drug use as providing alternatives. And so it's been amazing to see some of the patients as they've gone through this program and getting them back on the right foot and getting them through recovery and into being more active members of society. Next slide. We spent a lot of time at Neighborhood Now on the social determinants of health. You know, historically, as a medical shop, we did medical visits, but what we've learned is that that's great, but in terms of getting patients better, we have to talk about more. When I met with Mayor Mack before, I shared the story, you know, we take care of diabetic patients, and if they don't have a place to store their insulin or have proper food, am I really just wasting my time giving them insulin vials to take home? But if we can actually start to influence all those other areas in different ways through partnership, I think we'll actually be able to treat them better and get them better. And so a lot of our work is screening. So now we're screening for childhood experience. So we know that if you had trauma as a child, that influences how you receive and respond to treatment. So we're starting to do that in not only our children, but also in our adults. We started to partner with other agencies here in the community like Interfaith to help support patients who are struggling with housing or food insecurity. And then we continue to do advocacy work at the state and federal level to make sure that our patients continue to get access to health services. As we've seen threats to the Affordable Care Act, we're making sure that we continue that fight to make sure that healthcare is a right and not a privilege. But this is a lot of the work that we end up doing. What we know is that these social determinants of health, when we think about their influence on the total health of people, account for about 40% of that. Medical care being about 20%, another 30% being the behaviors of patients, so whether they smoke or drink, and then 10% being their physical environment. So there is a lot of influence these social determinants have on the well-being of our patients. Next slide. We also know getting health insurance can be very complicated. I'm not sure if any of you have had to enroll in Medicare or help someone do that. That is not easy. I tried to help my parents with that several years ago and kind of threw my hands up and I was like, man, this is not easy. And for our patients that suffer from low literacy, language barriers, this can get very complicated. And so the work that we have is we have counselors, certified enrollment counselors, who can help patients navigate to the various health plans that they may qualify for, as well as benefits through CalFresh. And so we find this vital. Again, you know, it's one thing to give them medications, but without food or without resources like that 2-in-1 provides, we're not fully doing the work that we can. And so through these enrollment counselors, we get them linked up. Next slide. So, you know, there's this whole thing of COVID, unfortunately, that has sucked us up. And I thought it would be important to just share a little bit of what's happened at Neighborhood. I'm sure you all are interested to hear a little bit about our experience and our response. So let me walk you through a little bit of what happened here with us and where we are right now. Go to the next slide, please. So in our world before COVID, we were only allowed to see patients in person. So our visits 100% of the time had to be in person. We weren't reimbursed in any sort of way if they were done virtually. So if a nurse called you to help you, that was not something that we could really financially continue to do or do. And so our business had to flip, or the way that we delivered care had to flip. And it flipped literally overnight with that first declaration that basically said that you need to provide care virtually. So within 2 days, we see about 1,400 visits a day across our health system. We had to figure out how to do that virtually and change our workflows, which we were able to do. There were some visits that we couldn't do, obviously, just it weren't safe at the time. But up to 90% of the visits that we had done, but historically, we pivoted to doing virtually. At this point, right now, we're doing about 60% of our visits virtually. And what that means is either they're video or telephone. We use Zoom platforms. We're on 3 different platforms, and then telephone. And one of the biggest barriers has really been on the technology for our patients. You know, telephone for the most part works pretty well. As a doc, sometimes you want to, you know, get your eyes on something, and that's been a challenge. You know, I still have done some visits to where they're putting the cell phone into the throat to see if I could look at their tonsils, and I'm like, it's too pixelated to sort out what's going on here. But you know, we've adapted. And so, but what we've heard is that our patients have been so appreciative, because we didn't want to bring high-risk people into the clinics if we could avoid it, and we wanted to provide as much care as we could in their homes. And so that's been really powerful. Next slide. Recently, we were able to purchase 3 of these Toyota RAV4s through some funding that we received through the federal government, as well as some local funding through one of the healthcare districts. And one of the barriers that I just mentioned is that, you know, we take care of these 8,000 diabetics. Those are the last patients that we want them leaving their home to get the care that they need. And so through this RAV4 and having a medical assistant drive this vehicle, we're actually going to their homes to collect lab samples that are long overdue, doing some screenings in the home. And then they're outfitted with technology where they can connect in to our docs here on site and have a video visit. So I did this last Friday. I saw about 13 patients, a mix of virtual and telephone, and was able to look at someone's wound on their leg, was able to just lay eyes on people as they were telling me that they're feeling short of breath. There's a lot that we can learn by just looking at patients that we were losing through the telephone. And then we're also able to order these blood tests and get them the services that they need. And as you can imagine, the patients are thrilled. They're, you know, as we've learned, patient behavior in this time is all across the board. We've got some pretty cavalier people, and then we got some really petrified people, and we're trying to serve everybody. And this is one way that we've been able to kind of meet that need. So you may see our RAV4 in the community out there decked out. We've also spent some time on media and outreach, understanding that there's a lot of information, some of it good and some of it just misinformation. And, you know, I think because of our street cred, a relationship with our patients, we've been really trying to inform them. And, you know, those basic things are so vital of wearing masks, good hand hygiene, and staying 6 feet apart. Really make a difference. And for our patients who are already high risk, we've been imploring them to do that. And this is one of our docs on Una Visión, sharing a little bit about neighborhood healthcare and some of those precautions, and really trying to reassure our patients. And, you know, what we found is that we measure our patient satisfaction experience, and that has gone way up during this time because the patients have really felt that we've been meeting their needs in whichever ways we can. I think I got one last slide. Yeah, and so I wanted to just wrap up by saying thank you. Thank you to you all for your support. Thank you to my couple of my bosses or your members, Elmer and Bill, and so that's great. And just wanted to say congratulations to Elmer Cameron for that Servant Leader Award. We're really thrilled to honor him in that way. And thank you to Sandra McDougall, who generously donated some baskets for our event as well. So I would end there, and obviously entertain any questions that the group may have.
I have a question.
There we go. Go ahead. Questions. We have about 8 minutes for questions.
I have a question.
Okay.
You have some beautiful offices, and I'm wondering, do you view a limited need for expansion of your physical offices in light of your experience with virtual visits, or do you even think of decreasing the footprint of your physical offices?
You know, I think that's a great question, and it's one that we've been struggling with. And so I can give you a little bit of the political landscape. And so where we are right now, we actually are allowed to do virtual visits because of the declared federal emergency right now. If it wasn't for that, we would be still forced by statute to do in-person visits. We've been doing advocacy work at the state level to see if we can make this permanent as a virtual offering for our patients. Unfortunately, there isn't a lot of political will at the state level to make that happen. And the reason is it's about reimbursements. That they say, we may allow this, but we won't pay you what you would normally make for a regular visit. The challenge of what they're considering paying us for it long-term versus what we make on a visit in person is not sustainable for us. And so what we've started to think about is there a way to just offer this service to really address those high-risk needs for our patients that just can't make it in, and understand that, you know, that's just going to be the cost of doing some of this business to keep people healthy. But to completely shift all of our visits to virtual based on what we're hearing is going to be difficult. The footprint, we've always been maxed at our site, so we actually now have breathing room, which is nice. We are continuing to expand. We actually are opening up a larger center in Valley Center, moving the Palma location in November. We're adding another site in Temecula. we see a hybrid of both. You know, we can't meet all the needs of our patients virtually. We need to see them in person for a lot of the screenings, like cervical cancer screening and breast cancer and things like that. But I think your question is a good one. Yes, I think there is going to be some flux there.
All right, Dara, and then Jay.
Hi, Rakesh. We hear so much about behavioral health challenges and the limit on providers. I'm wondering if you have a waiting list for your behavioral health outpatient services, and if you are able to see kids or young adults, that kind of thing. And
Yeah.
have you seen an uptick in the behavioral health needs since COVID?
Yeah, so that was like 3 questions, but
Sorry.
I'm just kidding. So, you know, what's been fascinating about this time with the virtual care is that we have been able to actually see a ton more of our behavioral health patients. So historically, we see no-show rates of about 30% in this space. We are down to less than 15, close to 10% no-show rates because we got rid of all those barriers that made it to get into our practice. We see children, so we actually have 3 child and adolescent psychiatrists on staff. Several of our therapists see children as well. Have we had wait lists? Yes. We continue to add. I just approved another therapist position here in Escondido. So we continue to see what the needs are. It's an area that, especially for therapy, that's an easier area for us to add providers. So if we've got the space, we do that. Tina and I have talked about at the school districts, is there ways to help kids through these times right now? But to answer your question bluntly, absolutely, we're seeing more mental health issues during COVID. There's no doubt, unfortunately.
Jay, go ahead.
How's your turnaround time for COVID testing? Is it better than what we've been reading?
Yeah, you know, it fluctuates. So right now it's pretty good. So right now we're about 2 days. We use LabCorp. Depending on which company you use, I think if you use Quest, it's a longer lag time. About 2 weeks ago, I would have told you it could be upwards of a week. So they've made some changes with LabCorp. And so now the test is actually useful. Before it was not even useful to take some of these tests now. So it's gotten better.
Hey, this is Roy Henderson. I have a question.
Roy, hang on 1 second, okay?
Sure.
Dr. Patel, can you hang out for a few minutes after the meeting?
Absolutely.
And
Yeah,
take
fine.
questions? All right.
Yep.
I'm going to go ahead and close the meeting officially, and then Roy will have you speak or question, just so that we can keep schedules flowing here. So for our closing, my shower thought for the day is giving a hug and receiving a hug are 2 completely different feelings. And we ring the bell to close out the official part of the meeting. Come on. Oh, I've got to get a better bell. And I will close that down, and let's go ahead, Roy.
Oh, you'll say leave it.
Yeah, hi.
Duck for cover.
Yeah, my question is, I guess, related to this virtual care. Can you hear me okay?
I can.
Great. Yeah, virtual care, I know you talked about the people feel risk. I know I've talked to my own general practitioner doctor. He's kind of, you know, the regular private practice doctor. And he says one of the problems is not the risk of walking in the doctor's office, but the patients are scared to. And he's concerned that he's not seeing patients that need to be seen, and the long-term effect, not only financially for him, but just for the health of patients, that people have this fear of God put in them so much that they're afraid to go to the doctor. Can you comment on that?
Yeah, no, we feel the same thing. My personal worry is really on immunizations for children. So we're making a huge emphasis right now of getting kids in for their physicals and getting their immunizations up to date. The other is around cancer screenings. And so, you know, this delay in colon cancer screening, breast cancer screening, you know, we'll see the ill effects of that, I'm sure, in the years to come if we're not careful. And so I would say we've been doing a lot of outreach to our patients to get them in. For those key things, but you're exactly right. I think we're trying to do public advisory announcements as well, like it's time to get immunizations, get your flu shots. You know, for docs that are going to have to decide, is this COVID or the flu? We're really afraid, so it helps if they had a flu shot at least. But yes, I completely agree with you.
Oh, we talked about testing. I know there's this last couple of weeks, these 15-minute on-the-spot tests have been spoken about in the news media.
Mhm.
What's the possibility of doctor's standard practice is once the patient walks in the door, you give them the 15-minute test as part of the routine of going to the doctor, and then you know for sure what you're dealing with?
You know, I think we're all hopeful. We had actually early on had purchased one of those tests that was under emergency use. And so we were able to use them. And then when they got more, got further down the approval chain, they changed it to where you had to be running a higher complexity lab than we run. So we actually have these tests sitting now and I can't use them. So it's because we're no longer fit under that criteria that was initially. So the rules have changed a little bit. I'm hopeful. You know, I think testing like what you talk about would really help us to get a better handle of what we're looking at. And it'd be safer for all of us, especially if you're going into a place and getting a procedure or something like that.
Okay, well, thanks.
Yeah.
Any other questions for Dr. Patel?
Yeah, Dr. Patel,
There you go.
I would just like to say that that was a great update on what's been going on, and neighborhood healthcare is really fulfilling the obligation and the duties that you guys have been doing for 45, almost 50 years now. So congratulations on a good job.
Thank you, Johnny.
So Dr. Patel, we're actually going to have the song. It'll be printed off, ready for framing, and we'll have it sent to you. It's our friendly song committee's job to do. And I hope you enjoyed it. And I also want to reiterate what Johnny just said. This is a great program. Thank you. I actually I go to neighborhood health myself, and you guys have great staff, great doctors. Really appreciate them.
Oh, thank you for that.
Anyone else have anything else to say? Where'd Sandy go? Sandy was here. She should have said, yay. All right, well then.
That's a great song, Bill Smith.
That was fantastic.
There you go. There's Sandy. So talk amongst yourselves. Enjoy yourselves.